Hello and welcome. I'm Dr. Charlotte Middleton and I'm the in-house GP for Healthshare. Today's topic for my video presentation is a topic that's really of great interest at the moment, particularly for pregnant women or women hoping to become pregnant, and it's the Zika virus. So you've no doubt heard about the outbreaks around the world and the concerns related to pregnancy, and I'll talk a little bit more about that in a moment. But to begin with, what I'd like to do is just give you a little bit of a background about the Zika virus and tell you a little bit more information about it. So what we know is that it's called a flavivirus. It's closely related to dengue. It's transmitted to humans primarily through a certain breed of mosquitoes known as the Aedes species, Aedes. I hope I'm pronouncing that correctly. They're commonly found in tropical or subtropical regions around the world, including North Queensland and some areas of central Queensland. And they typically breed in domestic water holding containers, and they're daytime biters as opposed to sunset or nighttime biters. The symptoms of Zika virus are actually usually very mild, and people either won't even know that they've been ill or think they've got a very mild illness, and it resolves really quite quickly. So what can you expect if you do have some of the symptoms? So some of the symptoms may include a low-grade fever, pain in the small joints of the hands and feet, muscle aches and pains, headaches, conjunctivitis, a rash, and often after the infection people can feel extremely tired and have a loss of sort of strength and energy. So they're all common sort of symptoms. As I said, it generally causes a non-severe disease, with the possible exception of the effects to the fetus in pregnant women, and as I said, I will come back to that in just a moment. The incubation period is around 3 to 12 days, and the acute symptoms typically resolve within 4 to 7 days. Now here locally in New South Wales, we've not had many reported cases. Most recently this year, we've had 2 cases reported from 2 travellers that have come back via the Caribbean and have unfortunately been infected. They were contained immediately, and they actually had very mild illnesses and are now fully resolved. So there's been no public health issues with those 2 cases. Otherwise, there aren't many cases up in Queensland that I have read about, and certainly when there are, they're very quickly contained. So there is no need to be alarmed is the bottom line here in Australia. Referring directly though to the Zika virus and pregnancy, there are some concerns that pregnant women who become infected with the Zika virus could transmit the disease to the unborn babies with potentially serious consequences. And obviously you will have seen the reports lately of a large outbreak in Brazil and a concurrent rise in the number of babies with congenital abnormalities and microcephaly, where the brain doesn't develop as it should. And while no causal link has yet been established, so that they can't say for sure that the Zika virus is causing this, obviously it seems to be a bit of a coincidence and it is of concern, and so a lot of research is being put into this at the moment to see if there is indeed a direct link between the two. While that is happening, and while we can't say for sure that there is no causal link, health practitioners around the world are actually taking on a cautious approach, and we advise women who are pregnant, and no matter what trimester, or who are planning on becoming pregnant, to avoid travelling to those areas that have had the most recent outbreaks. Now that includes South and Central America, Mexico, the Caribbean, Samoa and Tonga. So they're all places that you need to clear steer of if you want to avoid potentially contracting the Zika virus. If you have travelled to these areas and you were pregnant at the time, or you're concerned that you might have contracted the Zika virus, then obviously you need to talk to your doctor about those concerns. I guess I would like just to mention though that it should be noted that there's a number of communicable diseases around the world that pose particular risks for pregnant women, not just the Zika, so things like malaria. And so if you are planning on travelling at all while pregnant or planning to be pregnant, you do need to take all precautions and preventative measures against mosquitoes that you can. And the best people to talk to for that are travel doctors who can advise you on what you need to do to protect yourself while away.